to all the beautiful women out there, and especially the most handsome person sitting right in front of me, Dr. Bhaskara sir. And of course, as associates, the entire team of KIMS, Dr. Aparna, then Dr. Bhavani Madam, Dr. Vijay Lakshmi ma'am. She's not there today from Mirrors. Dr. Arvinda, Dr. Vinoda ma'am. Then Dr. Chinmay ma'am, Dr. Shilpi Reddy ma'am. Then we have Dr. Vinata ma'am, and Dr. Preethi Reddy ma'am. So I wish you all a very happy International Women's Day. Well, I think every day is a Women's Day. We need not have a special Women's Day like on 8th March especially. We have to be pampered every day to have a better life for the men. Now coming to the topic which Dr. Aparna has given me, I would not like to give some PowerPoint presentation or something like that, but a general discussion about how important is administration skills for a woman, and of course how important is financial independence for a woman. We all know that administrative skills are inbuilt in a woman. They are like inborn genetically, or as ma'am said, that we have things in us which are there by birth. So I think administration skills is there with us from by birth. It is just that we don't get chance to put it out. Not everyone gets a chance to put it out because we all are busy in our own jobs. But I feel doing a daily routine for a woman, like ma'am said, that even when she goes out, she gets a call from her mother-in-law saying that please get the fruits, because she knows that you are a good administrator. Somewhere you can manage the things equally for each and everything. Like for example, we get up in the morning, we do our work, we take care of ourselves. I think most of them may be doing yoga at home. So I think 1 hour of yoga is very important to start the day, which I do. After that, taking care of kids. Of course, I have a team to help me, to support me for my kids. I have caretakers. But still, I see to it that one part of my mind is already like it's with my kids all the time. So in the morning, I see to it that I am with them when they leave to the school, because once they leave to the school and I rush to the office, I don't know when I'm going to see them again. So it's the morning time. I see to it that I just leave them to the car, say them a goodbye, and then I come back to my room, get freshen up, do the puja, because we all, I feel, are spiritually related. So all the women, I think most of them will be doing a daily puja at home, which gives us a lot of power, right? And after doing this puja, then we are back, we are rushing to the office. So I feel that this is a kind of administration, and the similar thing which we use in the hospital, being a CEO or being a managing director, everything, taking care of each and every part of the hospital or each and every part of the unit is administration. And I think we can do it very smoothly. I won't say that men are not good at it. Men are good at it. But yes, of course, when they are into work, they are able to concentrate on their work. But we as men, we always have our brains divided in compartments. We have a compartment which says that yes, my husband is coming back home. I have to see that whether his favorite food is ready or not. Isn't it? Even if we are doing a surgery, or even we are on the chair taking care of our institutions, one of the factor will be surely running back of the home like, yes, today let me plan something for him. But as we see that it's not there for the men. Administration, again, being in the medical education or in the hospitals, I think freedom is very important for a woman or to anybody. And I really thank for my father-in-law and my family to give me that utmost freedom. I have seen many families or my cousins or my relatives saying that yes, they have been given a position in their institution, but nobody has the right to take a decision. What's the point in being on the chair? So having the freedom to make your own decision, having the freedom to make the changes, and having yourself a confidence on yourself that yes, I can do anything. This is what makes us a better administrator. So after that, I would like to also discuss about other things like having independence, or financial independence. I would say that this is very, very important because we cannot be dependent on anybody for money. I think doing a job, getting yourself educated in the proper way, saving money for yourself, investing in something which is very important. These all things matter, because as we say that whoever I just heard Priyanka Chopra telling about this particular thing, that whether whoever your father is, whoever your father-in-law is, whoever your brother is, whoever your husband is, or whoever your son is, doesn't matter. How independent you are financially, yourself is what matters. If suppose you are not educated, like we all are doctors, of course we have our own financial independence, we are earning well, we have our own way to earn ourselves. But if you are not a doctor, if you are just a housewife, still you can be financial independent. You can start a small scale unit, or else you can save money whatever your husband is trying to give you, or like some things we want to buy for the family household thing, save a little money from there and utilize it in the right way. I think even all these things are also inbuilt in us, isn't it? I don't remember, like, I still remember my father when, like, he was the chief medical health officer in Pimpri, in Pune, in Maharashtra, and he used to tell me, like, I lost my mother when I was at the age of 14. So, fortunately or unfortunately, I don't know, whenever he used to get a salary, he used to put it in my hands. I'm sure if they would have a son, he wouldn't have done that because he would have totally spent it on himself. So, maybe because I am a daughter and I have that particular vitals, so maybe he gave it to me and said that, okay, beta, just take care of the house. I said, okay. So I used to see that out of the salary, 50% we are able to, like, save, and the 50% I'm trying to put it on the household work. So after, say, 6 months or so, the 50% whatever I've gathered, I used to see my father sometimes, like, asking somebody on the call that I need money for such and such thing. Do you have money? So I took that bag where I saved that money and I tell him that, Daddy, you need money. This is it. He said, where did you get this money from? Where are you earning? I said, I did not earn. I just saved from whatever you gave me. So what we want to say is this is a kind of a financial, I won't say independence, but a knack of earning money. Saving money is earning money at the end of the day. And most importantly, as you say that nowadays we being women, we always, like, we give ourselves a last priority. Let us not do that. When we get up, please do yoga. Ma'am, I really like the way you explain the whole thing, because I think in today's generation, we all feel that, okay, it's something about me, I'll do it later. First, I'll concentrate on the family or first of work. Please concentrate on yourself first so that you are strong mentally as well as physically. And as well as we can see so many depressions going on right now. I think women are more prone to have this depression. It's just because we don't open up. We don't put ourselves out. We should talk. Instead of talking something which is not worth, talk what you feel like. Talk to yourself. You don't have anybody else. Stand in front of the mirror. Talk whatever you want to. Shout at yourself. Smile at yourself. Be happy. Whatever, however you are, feel that you're the best woman in this world. So this is the confidence which I don't know whether did I did not read any book or something on this, but yes, confidence does matter. There was a topic which we all were discussing that whenever there's a woman surgeon and anesthetist said that, well, I'm not going to give the anesthesia because let the next surgeon come or the senior surgeon come. No, it's like, I'm going to do it. As ma'am said, you do it or leave it. I'm going to take the care of the case, isn't it? And you anesthetize yourself. The same thing happens, especially in politics. I would like to give an example. Being my father-in-law in the political background, sometimes he asks me to go to some place. He gives me the absolute freedom and he has the confidence in me. But when I go there, they're like, they still wait. Is anybody else coming? I just said, Padandi, open chase them. I say, let's go, let's do our job, what we are here. So the confidence, the aura, the way we speak, the way we say that, yes, I'm enough for everything. It gives a very clear signal that you don't have to wait for anybody. So confidence is what we really lack as a woman. We know we are doing right. We absolutely do right. But it is just because the men out there are looking at us that, whether she'll be able to do it or not. And when we look into them and we said, we get a little scared. Another one experience which I used to have that, I don't know, it's not particular about anybody, but when I am on the chair, there are few men, they don't look into your eyes when they talk. So sometimes I tell them, excuse me, please look at me. I do this. I don't know why, but I said, it's very bothering. I said, do I appear to you like a ghost or something? Talk to me. You have a problem? Talk to me. They said, no, we'll wait for Dr. Badra to come. I said, he's not going to take a decision for you. It's me who is going to take a decision for you. Sorry, I'm being very clear. So I'm very upfront about my own decisions because I'm confident. I might make a mistake, I don't say, but I'll rectify. So I think if every woman tries to think about, think like this, saying that I am confident enough to do anything in this world. So we are already good administrators. We know how to deal with financial, situations. The finance minister in itself is Nirmala Sitharaman ma'am, who's home minister, the finance minister right now. So I think it says everything, like we all are meant to, we know to balance everything in our life. So this is what I would like to talk about it. And as, of course, thank you so much, Dr. Aparna and the team of KIMS for inviting me and giving me the opportunity to be one of the co-speakers. And I congratulate each one of you for achieving a great name in the society for being one of the topmost hospitals. KIMS as well as KIMS Cuddles being really one of the best hospitals in Hyderabad. And I think I myself got admitted in, in KIMS when I was not well. So it gives me that confidence that yes, I'll be fine when I'll be discharged. So thank you once again. And let me also talk about our institutions. She was asking me to please brief about myself and tell something. But yesterday I was in too many things. Today we had Kavitaka Garu coming in our campus. So we run MallaReddy University. We have 6 schools in this university with School of Sciences, School of Basic Sciences, School of Allied Health Sciences, School of Agriculture Sciences, School of Engineering, School of Management and School of Public Policy. So these are 6 schools with more than 5,000 admissions per year. So we have 2,000 admissions, especially in the Allied Health Sciences. I hope you know about Allied Health Sciences. It's not like paramedical, it is BSc, that is 4 years course in all the allied departments or paramedical departments like BSc in CVST, BSc in emergency, BSc in anesthesia, BSc in radiology, BSc in dialysis, BSc in respiratory therapy, and many more like medical biotechnology and all that. And we actually need this team. We all know we have a group of doctors working with us, but the supporters, the technician, the technical background is what we actually need. We have a nursing background, we have doctors, but the bridge between them is the technical people, which we actually need in today's scenario in all the hospitals. And we feel very, very proud that I, of course, consider Bhaskar sir as my mentor. And we don't have to have any official sign on the paper, but I'm sure that we will be corrected very soon for this allied health sciences, because we want our students, after they complete their 4 years, to go to all the best hospitals in this city. So recently we had a MOU with AIG, we had an MOU with Continental, we had an MOU with CARE, saying that we will do in-campus placements the way they do it for engineers. So they will be coming and they'll be taking these staffs for them so that they train in a better way. So this is one, and as you also know that we are running 2 medical colleges, that is MallaReddy Institute of Medical Sciences, MallaReddy Medical College for Women, and MallaReddy Institute of Dental Sciences, MallaReddy Dental College for Women. It is 200 seats of medical colleges in each and 100 seats of dental colleges in each. So MallaReddy Hospital we run totally free. It's absolutely free, right from the OP to the IP to the surgeries. Even we give 5,000 rupees DD to a female born child. That this is what we do. So I think we try to, thank you so much, thank you. We try to get connected to the government to get that this thing KCR Garu kit, but it was not possible. So we started with our own kit. So this is the present scenario. We are having a good number of cardiothoracic surgeries also. Last time we touched 100 cardiothoracic surgeries in a month. And even 150, more than 150 to 160 angioplasties per month, more than 500 angiographies per month. So it is for everyone, not only for the cash, for the credit, for Arogyashree, Arogyata Bhadrata, Vajpayee Arogyashree, for everything. You name it, you have it. And we are soon going to start a super specialty free hospital in our campus also. So this is just to provide the best teaching material, the best clinical material to all our students so that we produce great doctors. Because skill lab, how much ever skilled it might be, it cannot replace the patients. The clinical material is the priority, the most important thing. So this is the reason why we are making it free. And as I've already told that I'm really honored, like even in our medical college, 70%, even in the co-education medical college or co-education dental college, dental though 90% are women, even in co-ed. Whereas in even medical college, 70% are women. So I think let's preserve the men for the doctor positions. And next time, I think there should be an idea. What I feel that let the men arrange or organize a Women's Day for women. They should be the one who should talk about us, and we should be just relaxing and listening to them, having a cup of tea. Right? So thank you so much for this invitation. I really enjoyed this moment, and thank you once again. Thank you so much.